All right. Good day. My name is Tutor Muhammad Jiya Mohammed, who is going to be taking medical surgical nursing, course code GNS 311, special sciences disorder. This course is a continuation of what you have been doing in your basic nursing programs. When you hear the word special sciences, there is need for you to understand the special sciences organs, and there is no how you talk about disorders of the special sciences without you understanding the anatomy and physiology of special sciences. And what are those special sciences? We have the eyes, the nose, we have the ears, even the skin, even tongue sometimes can also be part of it. So therefore, but for the course of these lectures, we will be dwelling more on the eye disorders. When we are done with the eye disorders, we'll proceed to ear disorders. If time permits, we'll also talk about some of the few disorders of skin disorders, as well as the organs of olfaction, which is the nose. But there is need for you to understand each of these special sciences. We say we have the eye, the ears, the nose, the tongue, the skin. What is it for you to talk about disorder of these organs? You need to understand brief anatomy and physiology of each of these organs. Like the eye, just like you all know, is the organs of the vision. It's the organ that is responsible for seeing, ability of you to be able to see who is next to you, or see things the way they are. Your eyes must be functioning properly. And when you are having one challenge or the other, definitely it will cause a lot of issues to individual. And that's why these are some of the things we are going to discuss. So eye, in general, is just like we have said, it is one of the special sciences organs that is located within the orbital cavity. They are pairs in number, and it is spherical in shape. The human eye, majorly, it is made up of 3 layers. We have the outer layer, the middle layer, and the innermost layer. And of course, each of the structure of the eye, basically we can classify them into 2 compartments or into 2 categories. We have those structures that we have the structure of main structure of the eye, and we also have those ones that are accessories of the eye. What are those main structures? Like we have said before, that we have the outer eye, which include the sclera and the corneum. When you check your eye, basically that whitish part, it forms 56th part of the outer layer of the eye, and it is the portion you are seeing whitish, that is what we refer to as sclera. Then the corneum, that is the dark area of your eye. It carries 1/6 portion of your eye, and within this corneum, there is an aperture or opening we call pupil. That is where the light ray pass through to the lens. Then the middle layer of the eye, it contains structure like iris body, suspensory ligament, the lens, And it is also referred to as the vascular part of the eye, where you can see blood vessels, lymphatic vessels, and these are the layer that nourishes the entire eye of the individual. Then we also have the portion we call the innermost portion of the eye. Those are the places we have the photosensitive cells, such as cone cells as well as rod cells. You need to understand all these things so that when we come to discuss the disorder of all these various structures, you know where the problem is. Like I made mention of structure like all these in the innermost, we say we have the cone cell and the rod cell. Cone cell, these are the ones that are responsible for you to see in the daytime, ability of you to see the color, different colors. It is because your cone cells, they are functioning the way they're supposed to be. Then the rod cell, ability of you to see in dark moment, like in the night, it is the rod cell that are working, that are functioning. How about the road is for dark vision, especially during the night? Those are the things we are using. So now, we also have accessories, and people might have issues with even these accessories. Within your eye, again, we have what's called anterior chamber and posterior chamber, and you must take note of all these things I'm mentioning, so that when we come to talk about this disorder that affect all these structures, you will be able to know what and what is affected. We also have the accessory structures of the eye. We have accessory like eyelashes. We have eyebrow. We also have eyelid. We have upper and lower eyelid. And we also have what we call lacrimal glands that is responsible for secretion of tears. And within the eye, there is what we call aqueous humor that help to nourishes the human eye. It also helps to remove the waste materials that are being produced from the eye. So now within the eye, now that all we have now understand most of the structures within our eyes, what are those conditions that affect your eye? And if it affects your eye, what are those things that when you do to your eye, it will free your eye from developing these conditions? We have seen millions of people become blind because of negligence, some because of excessive exposure to chemicals. Like some of my ladies or some of ladies counterpart that they are very busy painting their faces. You see them painting their eyelid, putting a lot of chemicals within their eye. Some will want to put artificial eyelashes, putting a lot of chemicals within all these things, and most of all these things lead one way or the other to a lot of issues that they might not expected. So, what are those things you as a person supposed to do for you to avoid developing complications or problem from your eye? Yes. Fourthly, ensure you go for eye checkup every 6 months. Every 6 months, and we have we even some of the health workers. How many of us go for checkup? People, you see people going for checkup when they feel pains from their eyes. Some of them they will be having they will not see clearly. Some will be having color problems. Some will be having one challenge or the other, and they will be mute. They will remain where they are. No, they will not bother to even go for ophthalmic department to go and do eye examination. All these things contributed a lot in causing a lot of problems for them. So therefore, the first thing every individual needs to do is for at least go for checkup at least every 6 months. Then other remedies like health workers that are doing surgery, like when you are doing surgery, sometimes there is what called goggle glass that you need to put on. That is also very important because when you are doing surgery, so many the blood can splash and it can enter your eye. And whenever it splash and enter your eye, you don't need to go and consult any miracle. If that patient is HIV positive, if that blood splash into your eye, of course, it will be rapidly absorbed and it will get into your system. And from there, you also become infected. Then you also need to when you are swimming, you need to also put on swimming glass because as you are putting your eye in this, as you are swimming, the pressure that is mounting on your eye can lead to so many complications. Then not only that, when it is sunny, if the weather is harsh or maybe there is heavy rain, you should also put on your glass so that you can also be free from developing one condition or the other. So these are then when you are reading, it's very important. When you are reading, make sure you read in good lighting condition. Don't expose your eye to too much light and don't expose your eye to bad lighting conditions. When you do that, whichever you do, if it is too much, it will affect you. And if it is not good enough, it will also affect you. Yes, for the sake of this lecture, the conditions we need to look into, let me briefly highlight them for you to read ahead. Firstly, we have conditions like, in our next lecture, we'll talk about things like visual acuity and some of the investigations that we are going to do when you're having any of the eye or one eye condition or the other. Things like visual acuity and some other assessment we'll do in the ophthalmic department. Then some of the conditions that we must discuss during the course of our lecture in this semester, we have things like cataract, we have glaucoma, we have blindness as a whole, we discuss it. We have conjunctivitis, we have onchocerciasis, we have, which is also called river blindness. We have conditions like measles. We also have bulbitis, or maybe we have conditions like all these are cancer of the eye. And we also have other ones that when time permit, we'll begin to pick them one after the other and discuss them in our next lecture. Thank you all. Today, it is just an introduction of what we are going to be discussing. When next we meet, I will review the ears, the tongues, as well as the nose, because we also have so many conditions that affect our nose, things like nasal polyps. You see some people having epistaxis. Like ears, we have otitis media, we have otitis externa, and so many other things. Even traumas, different trauma can affect all these parts, and it can lead to so many problems. Then we also have conditions that affect the skin, like talk about all these elephantiasis, talk about even the skin rashes, even pimples and some other things. So as we continue, we'll begin to pick them one after the other and discuss them. Thank you.